Welcome again, everyone. Didn't realize I was being watched, but thank you again for being here. It's my pleasure to introduce our speaker, Dr. Liz Miller, and our moderator, Lynn Rubinson, the president of Watts, whom many of you know, and then Carly Coons of the Blue Dove Foundation is participating remotely from Denver, and they will be the movers of this morning's program. And I thank all of you joining on Zoom for being with us as well. And if you would like to ask a question, please put your question in the chat, and I will make sure that it gets addressed. And likewise, those of you here in person, I will be bringing a microphone around the room so you can ask questions of the speakers as well. So without further ado, I'll turn the microphone over to Lynn Rubinson.
Thank you, Todd. I'm so glad that you all decided to come out on a Sunday morning during JDEM. Just in addition to being president of Watts, I am an ally of disabled, and I have been on our disability task force turned into committee since its inception. And we have certainly accomplished a lot. So this morning, as you know, we're looking at building a resilient community for children and adolescents. And we are very fortunate to have with us Liz Miller, who is a professor of pediatrics, public health, and clinical and transitional science at the University of Pittsburgh School of Medicine. Liz is also a physician in the Division of Adolescent and Young Adult Medicine and the medical director of community and population health at UPMC Children's Hospital, with a focus on caring for young people who are system involved and, may I add, fragile. Okay. Liz has more than 20 years of practice and community partnered research experience. Good morning, Carly. Thank you for joining us from Denver.
Good morning. Thank you.
So Carly, who is on Zoom with us today, is Director of Education and Programming at the Blue Dove Foundation. She leads the organization in curating and creating mental health resources that integrate Judaism and mental wellness into communities. Carly has built a career in the Jewish community focused on youth and teen mental health, and residing in Denver, why she isn't with us today, and we welcome you. So I'm going to ask Liz to start and just give kind of a brief what she's been seeing and working with, and then Carly will do the same.
Indeed. Well, precious good morning to all of you who are here and on Zoom. Thank you for taking and making the time this morning to connect, because actually this, and your being here, is an act of resistance. So thank you so much for coming together. And Lynn was kind of reminding me, as we first started, Lynn and Todd pulled Carly and me together, we were going to talk about the adolescent mental health crisis. And while we will be talking about adolescent mental health, I had really hoped that we could take some time to think about how each of us can really work to be the hope at a time that feels intensely insane, and at a time where I am actually needing to sunset my research program because of the federal cuts that are happening. It would be silly for me to sit here and say, oh, things are fine and we're gonna just build resilient communities and it's just gonna, these are not normal times. And every opportunity we have to dig deeply into what each of us can do better in terms of strengthening our connectivity with each other and with our young people is what I hope we can achieve today. So I'll tell you a little bit more about my work in a moment, but want to bounce this over to Carly.
Thank you so much, Liz. And I think you've said it so beautifully. We are in, yet again, unprecedented times. I almost forget what a precedented time feels like. But the mental health of our youth is so important. Our mental health as adults who support those youth, who surround those youth, also really matters. So I'm excited to really talk about what are those protective factors that we have built into our Jewish tradition that we can lean on? What are the ways that we can lean on each other, and be that support for our youth and help each other through this really challenging time together. And that's one of the things we really focus on at the Blue Dove Foundation is how can we make those connections between Judaism and mental health to help us have these conversations to reduce the stigma around mental illness and addiction so that we can be a true support system to each other.
Thank you both. I'm going to ask a couple of questions, and please, please feel free to answer very openly. This is a safe space, okay, a sanctuary for expressing our feelings. So I'm just going to veer off a little bit of the topic. So given all that is going on now in our country, and with what we're seeing with cutbacks, or what we will expect to be cutbacks to mental health, it doesn't mean that we're going to have our adults, but more importantly, our youth, suffer any less. So what can we do, or where are we going to find help, whether it's from our healthcare system? Can you answer that first, Liz? And then maybe Carly, you can talk about some of the programs that Blue Dove offers.
Okay. So first, given that we're being recorded, I want to just make sure you all know that I'm here as a Temple Sinai congregant and as a member of our community, and what I say here does not at all represent my current employers. And it is also true that we are facing cuts to our social service, educational, healthcare, including research systems, at a pace that I don't think anybody was anticipating. And I want us to understand that cuts to Medicaid, cuts to food security organizations, cuts to childcare, cuts to, you name it, our public health infrastructure, every one of these impacts our community and is especially impacting our children and young people. And there's a sort of key message here, and I think the reason that I didn't want us to focus on the adolescent mental health crisis is that we've had a crisis in adolescent mental health and support for young people for the 2 decades plus that I've been a clinician. That is nothing new. We have systems that don't function well together. Our healthcare delivery system, often my fellow pediatricians have never set foot in a school district as a pediatrician, right? Which is like crazy. But those systems are so siloed. And so very few pediatricians know who the school nurses are, who school social workers are, much less teachers, right? And yet these are folks that we all share together in taking care of young people. And so if there's one take-home point from what I'm sharing today is making very clear our young people are not broken. It's our systems that are not functioning well and that we really need to focus on repairing. And so, Carly, how about I bounce it to you?
Absolutely. I think in the last, number of years, our country has made such incredible progress around conversations around mental health and creating systems to support people in crisis, like 988, the Suicide and Crisis Lifeline, which I hope will continue to remain, and we're not sure. And I think what I keep coming back to right now is thinking about outside of the clinical realm, right? We know people will need clinical support, and we all have mental health. We all will struggle with mental health. We will all have fantastic mental health days, and helping us to create a vernacular around mental health and wellness so we know how to talk about it. And in particular, our youth are so well versed in mental health They are so great at expressing how they're feeling in ways that previous generations have not been, because they've grown up with this conversation. And so I think one of the most important things we can continue to do and keep doing is helping adults and older adults educate ourselves around mental health so that we can catch up to where our youth are in the conversation and continue to be a support for them, so that if and when there is a crisis where somebody does need professional mental health, that we can be there to support them. But more broadly, that we know how to talk about mental health, to be there with them along the journey. And I am a firm believer that we are all teachers and we are all learners. So I think this is also such a great opportunity to think about how can our youth help our adults in the community learn about mental health through their lived experiences.
What, let me step back 1 second. What motivated each of you to want to get into this kind of work and work with youth particularly?
Oh, so many things. I did not actually ever, when I first started medical school, think that I was going to become an adolescent physician. In fact, I was going to become a women's health kind of primary care doc, maybe an OBGYN. And after doing my first delivery, I was like, that is just slimy and gross, and I don't think I want to do that. And discovered I actually really loved pediatrics. And so I took care of, I actually did my training in both adult medicine and pediatrics, and discovered that pediatricians start to get very, very nervous as young people start going through adolescence. And the adult doctors are like, oh my God, I'm an adult doctor, I don't do kids. And so I've always been drawn to people who are kind of, on the margins, or where others seem to be uncomfortable. I find myself going, let me lean in, right? And I don't know. Maybe some of that is being, bicultural. For those who don't know, I was born and raised in Japan, and so my mom was Japanese. My dad was a Caucasian man from Gulfport, Mississippi. And someday I'd be happy to share that whole story of how they met, because it's a beautiful love story. But my dad was very, very committed to social justice, and so he would always, every morning that I would head to school, he'd say, do the right thing. And that, I think, is something that is very much so part of my being. And I have always found myself drawn to work on the margins, and in this case have been for my entire, now 3 decades of work, have been focused on supporting young people who have been trafficked, young people who've been exploited, young people who are unstably housed, young people who are incarcerated and in the child welfare system, because they have been dealt such a complicated set of cards. And I'm sort of drawn to it because these are some of the most incredible young people. They are so resilient. And in my field, in medicine, we talk a lot about how hard it is to listen to people's stories of pain and suffering. And some of you have probably heard the term like secondary trauma and vicarious trauma. And I want to suggest to you that there is another way of thinking about this, which is vicarious resilience. I get so much joy out of sitting with young people and being allowed, right, just permitted to be part of their journey. And it is such an extraordinary privilege for me. And they do bring me a lot of joy. I, with every young person, start our visits with asking them to tell me more about themselves. What are they good at, and what brings them joy? And we have such delightful conversations. But one young person actually last week who is incarcerated, he's like, do you know, Ms. Liz, what's bringing me joy? And I'm like, what? And he's like, you, this. Right now. And I'm like, oh, it was just so delicious, right? And so we have that opportunity to see the strength and the beauty in our young people, and to amplify that.
That's Probably a conversation we should have with our own children. What brings you joy? Carly, what
So
motivated you?
it's a great question. When I finished my undergraduate degree, I actually found myself working at another Temple Sinai in Denver, Colorado, as the director of youth engagement, working with our K through 12 students. And when I was there, we had a month period where I had about six of our teens come to me struggling with suicidal ideation, self harm, either for themselves or for their friends. And I was like 23 at the time, wasn't really something I had known a lot about. And so I turned to some resources that I had in the community to figure out the best way to support those teens, to make sure their families had the resources they needed, to make sure I had what I needed. And when we made it through this particular January, and everybody was in a good situation, I remember turning to one of my colleagues and saying, "How did you know what to do in this situation?" And she said, "Oh, I'm a social worker." And I said, "Oh, I guess I want to be a social worker." And so I continued to work at the Temple for a few more years, and then got my master's in social work. And I'm a licensed social worker now, and have just really loved being at this intersection of mental health and Judaism. So I've worked at overnight Jewish summer camps, at synagogues, in youth movements, really thinking about when our youth are choosing to be in a place, right? When they are choosing to show up somewhere, they are more likely to bring their full selves, they're more likely to share. And how do we make sure that the adults working with our youth know what to do? What do they do when they share something that sounds concerning, or that might need a follow up? How do we make sure that the adults in those spaces create a safe space where people can share, where our youth can be sharing with us? So that's how I found myself in this more professional role. And personally, because I think, we all have personal and professional reasons we find ourselves in the paths we found. Personally, when I was in college, lost my cousin to a heroin overdose. He had struggled with addiction for quite some time, and it came as a total shock to our whole family. And for me, it really sparked my own mental health journey where I all of a sudden didn't really have coping mechanisms anymore, and my anxiety was really intense. And it started me on my own mental health journey to think about, how do I support myself? How do I make sure that people know it's okay to talk about mental health? How do I help people who are struggling with addiction, or people whose loved ones are struggling with addiction, figure out how to talk about it, which I'm so grateful to have found an organization like Blue Dove, whose mission is exactly that. So really thinking about this holistically, right? How do we support ourselves? How do we support the youth we're working with? And it's just been a great privilege and joy. Speaking of joy, right? To find myself at an organization that's so dedicated to having these conversations directly, so that we can really reduce the stigma around this.
Thank you. So it's easy for us to sit here and say, well, my kid isn't in the system and doesn't come from a broken family and doesn't have to worry about living on the streets. But I'm sure that there are other factors that we have to worry about, and not just look at our kids living in what we'd like to think of as secure Jewish homes. What should we be looking for?
So there are a couple points of data. I am a researcher, so you know that I'm going to bring in some numbers here, right? So a couple things to note. So, and several things can be true. Since the pandemic, we have definitely seen an increase in the number of young people who are sharing on national surveys that they're feeling hopeless, that they have a lot of worry, and the sort of number nationally that we have from the Youth Risk Behavior Survey, among the many data sets that were taken down last week and then put back up. This that in the number of young people, it's over 40% nationally who say that in the past year, they've had more than 2 weeks of feeling sad and hopeless, right? So it's about 2 in 5, right? And not every one of those young people have what we would call a diagnosable mental health disorder, right? So not every child needs a psychiatrist, not every child needs a therapist. Every child needs social support, and they need a sense of being able to forecast the future. So there are these two things in adolescent health research that we find over and over and over again are protective, meaning even when things are really crappy. You heard Carly talk about coping strategies, right? So these protective factors, when things are really tough, what is important? And what comes up in research over and over again are two things. One, every young person needs at least one important adult in their life, right? And that is hugely supportive. It may be their biological parent and caregiver, but it could also be a teacher, right? So a single important adult. And for my young people who are system involved, sometimes, right, that could be a mentor, it could be a teacher. One of the things that I do clinically, because it also helps me build community, is I will ask a young person who's like that important person in school. And a young person actually shared with me the other day, it was his special ed teacher. And he was like, it's Mr. Knox. And it's like, Mr. Knox at Brashear High School. Got it. I went and on the Pittsburgh Public School website, found Mr. Knox's email, emailed him to say, I just need you to know, right? This young person gave me permission to share with you what an important adult you are in his life. And thank you so much for loving on our kids, right? And I hope that that made it that teacher's day. But those are the kinds of things that each of us can do, is who's the important adult in your life and how do I strengthen that relationship? So that's part one, most important protective factor. The second one is what we call, in research language, future orientation, right? And so how do we measure that? We ask young people, are you excited about your future, right? Can you actually see yourself in the future? And we actually did a survey, and we have been, with the support of the health department, my team has been fielding every few years what we call the Healthy Allegheny Teen Survey. And we were able to compare numbers that we collected pre-pandemic in 2018 to where we are currently. So we collected these data in 2023. And one of the really worrisome findings was that in 2018, about 3/4 of the young people said that they had a strong sense of future orientation. They could see themselves in their future. That number has come down in 2023 to 50%, right? And I share that with you because future orientation is not a psychiatric disorder, right? That is something that each and every one of us can actually make a change, right? We can be part of Big Brother, Big Sister and getting involved. We can actually reach out to our area schools saying, can I help with planning field trips? It turns out when I shared this, with, our high school principals, and I was like, what happened to field trips? And they're like, we haven't brought back the field trips since the pandemic, right? And, that the schools are desperate for community partnerships and volunteers to be able to help think about these additional opportunities, right? And so moving the needle on young people's future orientation is actually something that each of us is capable of doing. And so I just wanted to share those two data points with you.
And those are important ones. So, Carly, there was a time, when it was very easy for Jewish people to kind of be blind to issues in our own community. Oh no, we don't have domestic abuse, we don't have drug abuse, we don't have alcoholics. I mean, we obviously know that that is very outdated. But are we kind of ignoring within the Jewish community what our kids might need and what kind of support they need? And if so, what should we be doing better, and who should be doing it?
Mm, it's a great question. And I think the Jewish community is experiencing what the community at large is experiencing, right? We have the same statistics when we are looking at diagnosed mental illness, when we are looking at struggles, when we are looking at addiction. So we're not immune to it. And in some cases, we actually have unique struggles, especially when you look at things like generational trauma, and thinking about our historical struggles that we bring forward with us into the future. I think one of the most incredible things about Judaism is that some of those protective factors that Liz was talking about, we have some of those already built into our systems and structures for our Jewish community. And so thinking about how can we lean into those to support our mental health. So some of the things, and these are some of the things that Liz was talking about, right? When we think about that connection to people, that social connectedness, and that like true connection with people can be such an incredible protective factor. It can help us, navigate isolation. It can help us when we're struggling, know who we can turn to. And that's something that's so a part of who we are as a Jewish people. It reminds me of the song that we used to sing when we were a kid growing up, wherever you go, there's always someone Jewish. This instant bond, right? That we have people who understand us or who are interested in understanding us. So leaning into that social connectedness, helping our youth find that connection with each other. And Liz mentioned, having that one adult can be such a game changer in a youth's lives. And a recent study by the American Psychological Association talks about how parents are so stressed that 41% say they are so stressed that they cannot function. 42% are so stressed that they feel numb. So really thinking about if our parents are in this sort of like fight, flight, or freeze state, what can we as the other adults in our youth lives, right? What can we as aunts, uncles, grandparents, teachers, coaches, family, friends, how can we show up and be that support so we can alleviate some of that stress off of our parents so that they can continue to take care of themselves and their children? Some of the other things, though, that I think about, that are our unique cultural protective factors built into Judaism, rituals, finding things that we can do over and over, things that ground us, right? We have so many rituals built into Judaism. Those might resonate with our youth. They might not, and that's okay. But how can we take that practice of a ritual and help them integrate it into their lives? How can we take something, and maybe it is reintegrating some of those rituals that maybe haven't been as important or we haven't had the time for because life is so busy. How can we find what that pause feels like for us on Shabbat? It might be a more traditional exploration, but it also might be a more modern interpretation of what does it mean for us to pause on Shabbat, to create that space for ourselves. Traditions, right? The things that we can lean on, the expectations we have, the structures. How can we help reintegrate some of those into our lives, into what we're doing? That spirituality, right? A connection to something greater. Another protective factor. How can we help our youth feel that? And especially as we're thinking about the future orientation and feeling like we can't even see a future, our youth can't even see a future. How can we help ground them in our present to let them know that we can think about the future, but also let's think about right now and let's just take it day by day. So I think, one of the greatest protective factors can be some sort of religion, some sort of spirituality. And so thinking about what is it in our community that we value or that our teens value, and how can we help them connect to that? How can we role model that? There are pieces of it that are cool, right? There are pieces of it that might work for us. And if it doesn't work for us, that's okay. Let's try something new. Just because one thing doesn't work doesn't mean Judaism doesn't work for us. Let's see what else is in there. Let's see what else is in our tradition that we can explore and try together.
So Liz, earlier, a little bit ago, you mentioned the data that showed what I interpreted as an increase in maybe feelings of desperation. Does that lead us to worry about increase in teen suicide? And if that's the case, what do we look for? What kind of signs do we look for? And how do we have intervention?
Indeed. So, yes. And so we are certainly seeing increases in young people who have thoughts of hurting themselves, as well as actually planning and then attempting suicide. And it's not sort of equitably distributed, across our local community and across the country. It will come as no surprise to any of you that our transgender, gender diverse young people are under extreme levels of pain and suffering inflicted really by state and national policies. And so what are the things that we need to be looking for? We need to be looking for isolation, kids being withdrawn, not wanting to go to school, not wanting to engage in activities, certainly changes in their eating, their physical activity, their sleep, right? So one of the things that we're seeing a fair amount of is disrupted sleep. And just, for parents and caregivers to pay attention to your child getting a good night's rest and really working on sleep hygiene. And those kinds of disruptions to kind of routine is one of the things that we need to be looking for, as well. And certainly we are seeing more young people engaging in self-harm and cutting behaviors and the like. And so, certainly, like if you suddenly see some, it's harder in the winter to actually pick up, right, those signs as well. Locally, we're very, very fortunate to have a robust teen mental health collaborative that is organized by the Jewish Healthcare Foundation. Jewish Family Services, JFCS, has Upstreet that is phenomenal. And in fact, I was with a group of alt-ed teachers on Friday morning, and they were all talking about the Upstreet counselors and how exceptional they are. And I promise I will reach out to Jordan and tell him that. But we have so much to be proud of in our region. We also have the Beacon, which is another drop-in center run by Friendship Circle, and then our JCC runs Second Floor, again another safe and supportive space. So within our local community, we have lots of different portals for young people to connect and highly skilled professionals kind of in those spaces to be able to also help to pick up those warning signs. We also have a program that's national, but we're really trying to push in Pittsburgh, that is called Coaching Boys into Men, originally focused on sexual violence and dating violence prevention. This is a program that trains athletic coaches to talk to their male-identified athletes about challenging rigid gender norms and recognizing respect in relationships and how to interrupt peers' disrespectful and harmful behaviors. And what we have now done is partnered with the National Council for Mental Health and Wellbeing that runs mental health first aid, and we've taken those elements of mental health first aid, built it into Coaching Boys into Men, so it's not only a sexual violence prevention program, but also one that promotes emotional health and well-being. So that's just one example of many existing prevention programs, but so easy to implement.
Those are wonderful to hear about, and I'm not familiar with all of them. So, are there volunteer opportunities with these groups?
1,000%.
There we go, guys. Okay, Carly. I mean, when we're seeing a rise in anti-Semitism, most often on our college campuses, I'm sure that we're going to see that also trickle down to our high schools and maybe middle schools. What is Blue Dove doing, or what tools are you suggesting in helping our kids deal with that, which can bring on feelings of desperation and isolation?
Absolutely. It is a real issue that we are seeing, and we're seeing it in all of our schools. I can say anecdotally here in Denver, I'm involved with a lot of teen programs here, and students share horrific stories of anti-Semitism that they see on a daily basis in their schools. And we know that also to be very true on college campuses. Some of the work that we're sort of thinking at college campuses first, some of the work that Blue Dove is doing right now is thinking about how do we help educate staff on college campuses about Jewish students. So we actually have just started with the University of California, Davis, and we are doing a 2-part series with their paraprofessional staff, so staff that support students that are not clinical staff, but they're counselors, they're the staff that interface with students on a daily basis, to think about how do we help them learn about Judaism? How do we help them understand the cultural diversity of Jewish students, the different backgrounds, and thinking about then helping them understand what are Jewish cultural protective factors that they can lean into, and really talking about what is anti-Semitism and how does it impact our mental health? How does it impact our physical health? And helping these professionals sort of role play and understand, if a student comes to you with a certain situation, how could you support them? How could you address it? So we've started with one university. We're hoping to expand to more universities across the country. And so far, it has been received so well. We are so grateful. But we also know this is happening in our local communities, in our public schools, across the country. And I think one of the most important things is thinking about how do we help our youth share when these things feel uncomfortable, whether that's sharing with the person who has said something to them that they don't feel comfortable with, or if they're not comfortable responding in the moment, who can they go and tell? Is it a friend that they really trust? Is it their coach? Is it their youth group director, right? Thinking about who are the different people that you can talk to when these things come up, helping them sort of build a repertoire of who do they go to for different challenges, which I think is something that youth have always struggled with, is identifying who they can talk to. But I think especially after the pandemic, we lost some of that social learning, and so our youth today aren't quite as strong at it because they lost those years of practicing it. And so I think that really falls on us as the other adults in our youth lives to remind them, who could you go to? Who could you tell? Who's the person you would trust with this? And so that's something else we're doing too, is really thinking about how can we support our youth to identify those people? How can we support the adults working with youth to know how to have those conversations? And then I think the other really important piece to this too, every time, and I keep bringing it up, but we also have to think about how we're supporting ourselves. Anti-Semitism impacts us as adults too, which I know I don't need to say to this room, you all understand that, but also prioritizing, creating some space for ourselves to make sure that we are taken care of. We are living through a time right now that I think our parents and grandparents and great grandparents would have never imagined us living through again. And so really making sure that we feel cared for, that we have people we can talk to, and perhaps sharing our struggles with the teens and the youth in our life, so that they know that it's okay to struggle with this, that you don't hit a certain age and all of a sudden it's no longer hard. There's a cutoff and it's not hard anymore. Letting them come into that conversation with you can be so powerful.
Thank you. So, as people sitting here, or anyone who might be on Zoom, and we may have I have an adult child who's living independently, but as a member of the community, how do I approach, or do I approach, or what can I do, or what can each of us do if we're seeing a child who's hurting and the parents may be oblivious or ignoring it? What do we do?
It's a great question, Lynn, because and I'm going to turn it back to each of you, right? Because it really is us recognizing that that young person is part of our community, and we have an obligation to build a relationship, with them. And as you know, and I think I was saying to Sue earlier, right? No young person wants to be lectured at, right? We all know that when we were young people, we didn't want to be lectured at either. And so, really, I suspect that all of you have those skills already in terms of how would I, right, reach that young person, just checking in, tell me how things are going, right? Conversation starters, like, so I'm hearing, like I went to this brunch on Sunday, and, hearing that a lot of young people are feeling really alone in a lot of their feelings. And, how are things going for you, right? Those kinds of little conversation starters. And in your resource sheet, I put the Center for Parent and Teen Communication. And while it is primarily directed towards parents and caregivers, there are actually many scripts and ideas. And that website was actually created by one of my dear friends and colleagues in Philadelphia, Dr. Ken Ginsberg, and is very much in that sort of strength-based kind of language of, how do we actually come from a place of strength and actually seeing that young person is an amazing young person. If you start from that place, as opposed to that young person looks like they're broken, right? The way in which we will approach them is quite different, as well.
And Carly, does Blue Dove have any tools to help other adults kind of see signs of, of children or young adults in their community?
Yeah, and in that resource sheet that is shared out, there are a lot of different tools to help you think about different ways to talk about mental health that maybe aren't necessarily so clinically failing. And the thing that I also, when I'm working with adults to help them support the youth around them, that I always remind people is that you might be the person who notices something is off, or that you can just tell something isn't right, but you might not always be the best person to address it with that teen or with that youth. So thinking about who else can you talk to as well. So if it doesn't feel comfortable for you to do it, if you don't have the bandwidth that day, if you don't know that teen super well, but you've noticed something is off, who is it in your community that you can talk to, who then can follow up with that person? So it's just that reminder that it doesn't all sit on our shoulders, that we can approach this as a community and we can do this together. And it reminds me of the Jewish value of Kol Yisrael, Arvim Ze Leze, that we are all Jews, we are all responsible for one another, that permission that we can do this together communally.
What didn't I ask you that you want to impart upon us?
I really, really appreciate the opportunity to share some time with you.
Carly, anything you want to add before we open it up for questions?
The last thing I'll add is just even having a program like this, and I think Lynn and Liz, you both said this, but this is helping normalize that this is a conversation we can and should be having. So just by being here today, by listening, you are making such a big difference.
Great. Questions? Frank? It's on the side. Oh, okay. Perfect.
I have two questions. Number one, how you were, Carla, you were talking about connectivity with your Jewish community. How do we entice the parents that this is important for their children? I mean, we outreach and try to tell adults that being part of the Jewish community, being part of a synagogue community is important, but to try to entice them that this is important to their children as much or more so than to them. And the second question is, you were talking about anti-Semitism and how kids are dealing with it, and how is this different than how our parents and grandparents dealt with it, which was, of course, in a different period, and internet didn't exist back then. So the two questions.
Absolutely. They're both such great questions. And I think first and foremost, when we're thinking about how do we help entice our youth to want to come, I think it's really thinking about what is it that the teens want to be doing. There's nothing less cool than your parents saying, you should come do this thing. So really thinking about, are there teen leaders in your community you can tap into, and starting small, as somebody who's worked at many congregations focusing on youth programming, thinking about what it means for them to be in this space and letting that drive the programming that you run, and really letting it be team-led is so powerful. One, it's such a great learning tool for them. It helps them develop their sense of self, build their resume, right? All of these things. But it also will inspire their peers to come, because it's not an adult saying they should try it out. The other piece about anti-Semitism, and Liz, I'll let you share on this as well. But I think you sort of hit it on the head, is that the connectedness, which is such a gift, right, can also be really challenging when we're walking around with the computer in our pockets all the time. That is connecting us to people and helping us feel like we're growing and building. It can also be really challenging. So social media, while it has so many beautiful benefits, is also, we just have this constant stream of information coming at us all the time with no break, no reprieve. And I think in particular, the interesting thing that we're seeing with anti-Semitism when we're looking at social media is that things that people maybe wouldn't say to your face in person, they are very comfortable saying in the comment section, on a TikTok video, on an Instagram post, in a direct message. And how isolating to be, scrolling through your feed, a place that, you feel really connected, that you find friends and you learn about books and you learn how to do different crafts, right? A place that brings a lot of joy. All of a sudden, there are comments about anti-Semitism. There are comments about hating Jewish people, and you're alone, right? You're sitting by yourself in your living room or in your bed scrolling, and all of a sudden you're experiencing this anti-Semitism sort of in a vacuum by yourself. And so I think that's one of the really interesting things that we're seeing, is that it's such an individualized experience in a way that perhaps it hasn't been historically. It was more in our public town square, and now it is in our individual town square on our phone. And so really thinking about how can we be having these conversations with our teens to let them know, not if anti-Semitism comes up, but when it comes up, who is the person you feel safe talking to about it? Who is the person that you could share? I saw this thing on TikTok, I saw this comment, and I can't get it out of my brain, right? It's not sitting right with me. Who is that person you can talk to about it? To think about, do you want to respond? Do you not want to respond? Do you want to do something actively to combat this, or do you want to just let this go? And sort of navigating it. I think the challenge with social media is that we can be keyboard warriors. We can respond to every comment, and it might not make us feel better. It might not actually make the impact we hope. So what are the alternative options when we're experiencing this online? Liz, I want to turn it back to you to see what you think.
This is so much fun. I've so enjoyed learning from you, Carly. And I love that term, keyboard warriors, right? There are other options and thinking through. And so much of this is having these conversations about, when you experience this, right? When you experience anti-Semitism, when you see anti-Semitism, how are you going to respond? When you see racism, how are you going to respond, right? And one of the things that that we have in Pittsburgh that I'm so proud of that has come out of the 1027 Healing Partnership and the Global Summit to Eradicate Hate is the Light Initiative, led by Nick Haberman, who's a former teacher from the Shaler School District, who has been so intentional about Holocaust education in schools that have now sort of shifted into eradicate hate clubs in many of our area school districts, right? And so creating space for young people to learn with each other about the multiple ways in which identity-based discrimination shows up and how and when it shows up, how we can be better supports for each other. So what's exciting for me about those opportunities going on in schools is we can also do that in the context of our synagogues and community centers, which is having very honest conversations, right? And not participating in what I call oppression Olympics, right? And what do I mean by oppression Olympics? Oh, my experience as a Jew is worse than your experience as a black person. I mean, it's ludicrous, right? That what we have to prepare young people for is understanding the ways in which oppression works and the ways in which it continues to drive wedges, right, and divisiveness, and how do we counter that? And I think, given that in my own household, one of our kids is very much, as many young Jewish adults are, in the anti-Zionist space, right? How we as adults, as Jewish adults, have to both be accountable for what did we miss in their education along the way. And I think, our eldest will say, we never had an honest conversation about Israel, right? Wanting to actually learn more about that history. And so how easy it has been, and we've slipped into this space of, young people using language that they're learning around colonialism or kind of anti-racist frameworks that don't actually fit what's happening in this just centuries old conflict in the Middle East. And just feeling this sense of, what do we need to do to rapidly come together in all of our Jewish spaces to have more honest conversation? Because our young people are craving that, and they want to learn. And, I do think that, as our kids were going through adolescence, that we tended to just go, and sort of pull back from some of those really complicated conversations. And so among the things that my colleague Ken Ginsberg and I have been engaging in is, how do we actually have a section within that website for Jewish parents and caregivers around starting to have these more nuanced and honest conversations, as well. And so I think that it is really about giving our young people lots and lots of options for coping strategies and solutions, and simultaneously for us as Jewish adults to be really thinking about what we can do to strengthen our learning, build our skills, right, so that we can actually engage in these what feel like tougher conversations with young people about being Jewish in the United States today.
You actually answered the question I was going to ask next, which kind of leads more as well into, we are in an age of intolerance. I mean, I personally feel that we're seeing more intolerance today since the 40s. So how do we prevent our kids from falling into that trap when they're hearing so much? And you answered a lot of that with the anti-Semitism. I too have had that difficult conversation with my 34-year-old son, because we just assumed, frankly, it wasn't that we didn't have the conversation. Jewish day school, we just assumed that they had that sensitivity. So how do we identify if they're starting to fall into that intolerant zone, and how do we make sure we pull them out of it? I'll ask both of you. Carly?
Yeah. I mean, I think when we're having these conversations, really thinking about or giving ourselves permission to not have the answers, which I know as people, we like to have answers. We like things to be neat and organized and fit in boxes. But these conversations, just by nature, are messy. And so I think leaning into that mess, leaning into that uncertainty, which can be challenging, right? To have a conversation and not know where it's going to go. But when the opportunity arises to say, hey, I want to talk about this a little bit more, knowing that you might leave that conversation saying, wow, I hadn't thought about any of this, and letting that be okay. Letting the first conversation just be a listening to each other moment, right? So I think giving ourselves permission for it to be a messy conversation, for us to not feel shame in what we didn't teach or what our youth don't know or what they wish they had gotten right. Like just letting it be a place where we can have conversations with each other. And then I think the core of it, right, is remembering that we as Jewish people are always thinking about others, right? And so how can we lean into our Jewish tradition to remind us that, you know, we should be hearing other people's opinions, that we should be questioning, right? We're a tradition built on asking questions and questioning each other. So how can we let this be a space where we're questioning, but also still including, and respecting other people's perspectives while also not hating, right? So again, it's messy. Even just talking about it now, I'm like, wow, it's easy for me to say, but it feels messy even saying it to now. So again, I think that permission to lean into the mess, to let it be uncomfortable, and see where that conversation takes you.
Yeah,
Anything
I
to
have
add?
nothing to add to that. That's perfect.
Our 7th and 8th graders are going to the Holocaust Museum in about 2 weeks, and Cantor Regina's prepping them upstairs right now for it from the synagogue's perspective. But what can we do as parents to prepare our 14-year-old daughter to go to the DC Holocaust Museum?
Carly, you want to start?
Sure. And I say this also from the perspective of a 14-year-old who went to the Holocaust Museum in DC. He's very sensitive. I still am a very sensitive person. And perhaps what I wish my parents had thought about before I went, or what my school had thought about, I think acknowledging that it might bring up feelings and not naming what those feelings could be, because we all have different experiences. I've also staffed trips to Poland, and brought teenagers to concentration camps in Poland, to bear witness. And I think one of the things I have learned from both experiencing it myself, but also taking teens on those trips, is reminding them that whatever emotions that arise for them are okay. If they go and they feel nothing, that's okay. If they go and they feel a lot of feelings, that's okay. If they go and they all of a sudden want to learn more and are so interested and want to read and educate themselves, fantastic. That's so great. So I think reminding them that to just be in touch with themselves and recognize what what they're experiencing in the moment, and reminding them that you are there, that you are an open space, that they can text you and say, super hard today, right? Or interesting, right? Like letting them communicate with you in whatever way they communicate with you and not needing it to be a bigger conversation. But if they're interested in that larger conversation, reminding them and just continuing to remind them, as you do as parents and caregivers, that you are there for them to talk about it.
Question?
I got two questions. Do you feel that our synagogues and our teachers at the schools, and I'm from Rhoda Sholem, do you feel that they're in touch with, and if they have a student that's a bad student or someone that one could easily recognize has problems, that they just kick the kid out of class, or they are willing to dig in and maybe talk to the parents and get deeply involved? That's one question. And the other one is when you watch TV and on a weekly basis you hear about some 19-year-old in Pittsburgh having guns and shooting somebody. This happens on a weekly basis here in Pittsburgh. And it's easy to resent them and not to be open-minded about taking care of them, so to speak. A lot of resentment there.
Maybe we need to look better at gun control.
Maybe. So, in terms of the sort of suspending students, kicking them out of school, right? This is a pattern that we've seen for, a number of years. And, there has been actually locally a lot of advocacy to actually really curb the amount of suspending that's happening and the amount of push out that was happening. So for example, 2 years ago, and then we've continued to extend it, within Pittsburgh Public School District, we have a moratorium against suspension 5th grade and under. Right? It used to be that it was fine to suspend a child in kindergarten. Like, how crazy is that, right? And so I think we're making steady progress into understanding that we have an obligation to provide intensive wraparound services, right, to help children stay in school. And I'm working with a number of area school districts on reducing absenteeism, reducing tardiness, just increasing that sense of connectedness in schools. And so that work is in progress. Similarly, we have and have had to date significant funding in the county to address community violence and youth violence. And actually within the city of Pittsburgh, we've seen a dramatic drop in gun violence in the last year. It's something we should be very proud of. It has required a huge amount of coalition building across nonprofits that have historically not actually worked with each other, largely because they were competing for dollars. And so the coalition building has been, we require everybody to work together. If you want to get funded, then you need to work within this network. And, unfortunately, in the current state of affairs, we actually, with the mayor's office, had submitted a grant for some work that we're doing in the Knoxville, Allentown, Mount Oliver neighborhoods, again, to provide high-intensity wraparound services for families where a young person is at risk, either for using violence or for gun violence being used against them. It's often both, right? And we have, and that, as you all know, right, the CDC is under, the Centers for Disease Control and Prevention is under tremendous attack right now. And so, we will continue to find sources of support, hopefully local and local philanthropic support to continue the work, because the progress that we're making is really pretty phenomenal. And it really is, instead of like seeing that 19-year-old as the bad person, to say, what are all of the situational factors, right, that contributed to the need to use harm and the need to use gun violence. And of course, gun control would be, we have to keep dreaming, right?
So I'm just going to take a minute and give you a public service announcement that we're going to have some special elections and a mayoral election coming up, and these are some of the questions that you should be asking candidates when you have the opportunity to go to public forums. Can't help it. Have to say.
I just wanted to comment on something Liz said before about we sometimes think that our children learn from us by osmosis, by how we walk the walk. And maybe we need to remind ourselves to talk, and it's not just to our teenage children, but to some of us have adult children, and we need to remember to talk to them too. I think that that's something that your comment reminded me to do.
Well, we can take one more question. Anybody? I want to thank you, Carly. Oh, I'm so sorry.
Specific volunteer opportunities. So I think it is really thinking, very hyper locally. What can we do to continue to actually grow intergenerational programming within the synagogue, right? So that I think is one place. For those of you who are interested, Upstreet, second floor, the Beacon are always, looking for additional support as well, and as is the Teen Mental Health Collaborative through the Jewish Healthcare Foundation. And then if you are, interested in mentorship opportunities, Big Brother, Big Sister is always looking for more mentors, and as are our area school districts. And so depending on what neighborhood you work in and live in, I'm always more than happy to help connect the dots too. One of the things that's remarkable about our region is we have a plethora. Actually, I've never actually worked in a community where there are this many community organizations, this much philanthropic foundations, and really committed folks. So we have a lot of assets and resources. What we don't do well is actually connecting the dots across those assets and resources. And so building that connectivity, I think, is really something that each and every one of us can do.
One more question. Carolyn?
My question is, how would a youth or an adult find a psychiatrist to discuss this sort of thing with?
So what I would say is sometimes what we think requires psychiatry may not necessarily. And so it's really, there are many of us in our community, including the youth serving agencies that I just mentioned within our Jewish community, where there are many professionals who are very skilled at working with young people and their families, to help just kind of increase the skills around sort of coping and managing and so forth. One of the things, I'm going to go back to sleep, right? The sleep and making sure that young people are getting enough time, and rest is such an important thing. And we so quickly go, oh, this child needs a psychiatrist and they need to be on medication. And I will back up and say, okay, let's focus on the basics, right? How much exercise is your child getting? What are they eating? And what's the bedtime routine, right? And bedtime, people are like, a bedtime routine for a 16-year-old, they're on their own. I'm like, oh no. Right? Let's do that, and it is amazing because the young person the other day who was like, Doc, I'm like sleeping and I feel so much better. I'm like, right. It's so much better than, and again, not to denigrate medication. Medication's great when you need it, but focusing on those really basic things and helping people like just revisit skills that most of us are like, yeah, actually, I probably could use a little bit more sleep, right? And so there are things that are very fixable that rather than going, immediately to the place of like they need to have a subspecialist managing, I think there are a lot of things that we can do to help our young people today.
Would the psychologist refer someone to a psychiatrist?
If they need it, exactly.
Because psychiatrists in Pittsburgh are very difficult to find.
Exactly. Yep. And so often, they'll see me. I'm not a psychiatrist. I'm trained in adolescent young adult medicine, very comfortable with the bulk of behavioral health, concerns that young people have. And then when I'm like, not so sure, I have the ability to call a psychiatrist, get some guidance, and then continue to follow through. And so I'm able to share with the young person and the family, this is who I've consulted with, and they agree that this is the plan moving forward.
If the psychiatrist person thinks that the person needs medication?
Yep, absolutely. And so I will do a lot of the prescribing myself.
Okay.
Yeah.
Any last questions? Barbara?
You mentioned several times imminent or potential cuts in funding to the programs. And I'm just wondering if there are people locally who are fighting this, and are there, people at the universities or whatever? What activity, what resistance is going on?
Yeah, it's a good question. It's actually feels like such a massive flood right now. It's a little hard to figure out. I will say that our university leadership and hospital leadership, folks are really, really leaning in to try to understand what the impact of some of the cuts are. The challenge is every single day there's been something new, and the reality is that I have had research grants that have received cease letters from Health and Human Services, and just am kind of counting on university leadership to push back on those, right? And then I do know that our local philanthropic foundations are being inundated right now with requests from researchers to support their research because of the fear of the NIH and other National Institutes of Health and other cuts that are looming. So it's a really, really uncertain and overwhelming time. And there are many of us who are basically forging ahead with the work until we're told to stop.
There is
And the
also
governor as
a
well.
group on Facebook under OOP, and it does list when there are protests going on and in front of our local representatives and our federal representatives talking about budgeting and everything. So as we call praying with our feet still helps. Were there, I can't tell, Todd, are there questions online?
No, there are no questions online, but I do want to mention that Liz and Carly were kind enough to put together a list of resources, and we have some hard copies, but we'll also email this list to you because there are links to websites that you or others might find useful. So if you would like a copy of the list of resources, please see me before you leave today.
Carly, thank you very much for spending your morning with us and sharing with us such great information and letting us know that there is an organization like Blue Dove out of there. And Liz, we continue to be so proud and supportive of the work that you're doing with such a fragile community and helping us learn and understand and hopefully take some action so that this is not the end of the discussion, but hopefully the beginning. Thank you, everybody.
Thank you.